make my day. I'm missing it when I'm gonna love for you. Keep me up. Only you alone.
Casualty 911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases. It is your social, economic, physical, spiritual, and mental well-being. Just imagine you on 88.5 Soufriere FM, talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
Sex? Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Soufriere FM, tell a friend, call your neighbor. Casualty 911 is on.
So good morning, everybody. Today is a wonderful Monday. Of course, a word of advice for persons out there suffering with the flu. Do take care of yourselves and don't forget to seek medical attention. Don't think that you are very, very strong and you stay home. Seek medical attention, boost your immune system, do what you have to do and stop the spread. So we're asking parents, if your children has a runny nose or they have flu-like symptoms, keep them at home. Do not send your children to school. And that is one of the problems that the principals and the teachers are having. And the thing about it is the teachers get the flu too. So who is there to teach your child when you send your child to school? Yeah. So be mindful of all of that. I trust that everybody had a wonderful weekend. And of course, this Monday, I would like to say good morning to all our listeners out there, especially in the Choiseul, Soufriere, and Canries Basin, and persons listening online. Good morning again. So this morning we're going to speak about, we're observing next month, World Cancer Month. And of course, cancer is one of our biggest concerns, especially in our communities, amongst family. And that is why we're observing World Cancer Month. So World Cancer Day is February 4th, but the entire month of February, we're recognizing it as World Cancer Month. And again, for the theme we have, detect early, live fully. And that is one of the things we want persons to come out to ensure that they do the necessary tests to detect cancer very, very early. So why the public awareness? And why do we really speak about cancer every time we try to encourage people out there? One of the things is many of you are unaware of the early warning signs of cancer. And sometimes you might think it's one thing, the doctors might think it's something else. And really and truly, some of us do not know the early warning signs of certain cancers. And I, for one, was part and parcel of that too, because I did not understand certain things about a particular cancer. And sometimes there are rare and as well as common cancers. So we'll speak about that in a little while. And one of the things we need to look at is the risk factors. We have been saying it for quite a long time. And we're asking you simple things. Avoid tobacco. Do not stay around people that smoke. Do not smoke. We keep on telling you to maintain, a healthy weight and engage in a balanced diet. And we have been saying that for years on the radio program. some persons tend not to take heed, and I can tell you it is so important to maintain a healthy diet. It goes a long way. And doing your regular health checks. I mean, it's the beginning of the year. What have you done? Have you done your blood test? Have you done your pap smear? Have you done your PSA? And these are the things that we're encouraging persons to do. Come into our wellness center and speak to the health professionals. And so you can reduce the risk of cancer. And these are simple steps that we're asking. And these are the things that you need to take into consideration. It's just not about, I feel sick, I go to the doctor, I am diagnosed. No. There are things you have to do in between. And these things are most important. Yeah? Again, knowing your family history, that is so very important. Many of us do not know our family history as it relates to cancer. And we need to know these things. And adopting a healthier lifestyle. Yes, we think we're eating healthy. Sometimes we don't get enough sleep. We consume a lot of alcohol. We need to adopt a healthier lifestyle. And that is one of the reasons why we are here today when it comes to cancer and observing all the different types of cancers today. And why is it important? We ask ourselves, why is it important to, detect, for early detection? Why do you feel that we need early detection? One, it reduces on your financial burden. Because when you detect cancer at its late stage, think of your family, the emotional support that you're expecting. That means sometimes you're unable to do things for yourself. That means you're in the care of others. Think of it. The pampers to buy, the medication to buy, the pain and suffering. Yeah. The sleepless nights, not only for the patient, but for the person who's taking care of that person. So there are so many things that you need to take into consideration. Sorry. So this is one of the things that we're asking persons to do. Yeah, go out there, do the necessary test that is needed to the early detection as it relates to early detection for different types of cancers. Now, one of the things, and I've been saying it throughout the month of January in my presentation, is supporting patients and knowing the services that are available for these persons. So once you diagnose with any form of cancer, one, it has an impact on your mental health. You start thinking, you start losing weight, some of you. You're thinking where you getting the money. Other family members start thinking too. Some family members are in denial. You tell them you have cancer, but they still believe because they're seeing you like a normal person, like you don't complain you have pain or anything. They're in denial, like they will not believe you actually have cancer. And, your children, you have to think of your children in that process, how young your children are. Are they of working age? Who's going to take care of them? All of these things sometimes gets you thinking and can really affect your mental health. And what services are there available within our country to help you out? Now, there are free services now, and many people are not taking advantage of the free services. And I've been saying it about the mammogram as well as the PSA for the prostate. And I'm not seeing the men coming out, the men over the age of 40. We're seeing the older men, but we're not seeing the 40 to 45, the 45 to 49. We're not seeing that age group. We're seeing the 50 and up or the 55 and up. We're not seeing the younger generation, and we need to start seeing them coming in. So when you have the free services available and you're not taking advantage of the free services, after a while, when it's no longer available, then it's going to cost you. It's going to cost you. So the financial strain is on you and your family members. And by extension, it will start affecting your quality of life. Because if you're diagnosed with cancer, you have to take treatment. There are times you'll not be able to work. There are times you'll not be able to do things for yourself. So of course, it will start affecting your quality of life. And that's what people need to understand. That means the person that is taking care of you now has to curtail their life to support you. So they have to do a 360 turn. So their nightlife might no longer be the nightlife that they used to have. The things that they used to go and enjoy is not the things that they can no longer enjoy like before, because they have to stay and take care of you. For example, if you're one person at home that has one sibling or maybe one child, that means that person has to make time to take care of you. But don't forget that person might have a family also. Can that person leave their family at nights to come and take care of you? How long can that person do that? Should that person neglect their family to come and take care of you? So that is why early detection is key. There are people who would make the sacrifice. There are people that will not make the sacrifice for you. So you have to take all of that into consideration. You need the support, but it takes a lot to offer the level of support that you will need as someone that is taking treatment for cancer or you're in the last stages of cancer. So you could well imagine all of these things. And that is one of the things that is why we're here, to create awareness. It's just not about, knowing that there are cancers out there, but taking the step to ensure that you do the relevant tests, take the relevant treatment, and ensure that you have some monies. And that is one of the things we've been encouraging young persons. You need to start saving for your financial health, for your health. You need to have some monies available. You need to make yourself, make sacrifices sometimes. If you're diagnosed with cancer, you'll not have all the monies available, but at least you can help yourself, to do 1 or 2 tests. And that's what we want persons to do. But if you always online shopping, you're in all kind of activities, you with that notion, one life to live, I'm enjoying myself. I'm not saying don't enjoy yourself, But the moment you're sick and you have to do a few tests and it's going to cost you money, who do you expect to pay it for you? And you're of working age, you have been working, and you've been going out there squandering your money, and you expect persons who have tried to save to provide all the financial assistance for you, when they themselves have other responsibilities. They might have their loans to pay. They might have their children to send to school. So are you telling me that you did not save your money, but I saved my money and I have to be spending it on you all the time because you are sick? Think about it. That is why you need to save or get medical insurance or do what you need to do as a young individual. At that time, think about it. What is more important? Yeah? And these are the things we want young people to take into consideration. You have to go and do a surgery costing $5,000. You want to raise funds for $5,000. I mean, you need to put savings in place. And these are the things we want you to consider. So, having said that, last year, 2024, according to the EPI unit, we had 2024 for various types of cancers. We had 101 female dying, and we had 67 males dying. So in total, we had 168 persons dying of cancer. Now you might say 168 persons. That is quite a bit of people. And more females than male. You could well imagine. And you say, oh, but you have been encouraging all the men to come out. But that was just last year. 2024, sorry. So within the time frame of 2018 and 2024, we had 1,519 persons dying with cancer. So you could well imagine. Imagine the number of persons dying on a yearly basis with cancer. Of course, we have survivors. We have many survivors. So, 2024, 168 persons dying with cancer. 2023, we had 330 persons dying with cancer. 2022, we had 282 persons dying with cancer. But within the 2018 timeframe to 2024, we had 1,519 persons dying with cancer, where females account to 820 and male accounts to 698. That's a lot of persons dying with cancer. So these are the things we need to take into consideration. And like I always say, you never know what it is like until somebody close to you dies with cancer or is suffering with cancer. You never know what it is like. The pressure, the stress involved, the family ties, and all of these things. And that's one of the things we need to take into consideration. One of the things that can really, really affect us after death, after the person's death, it can really have an effect on you, your grieving process. How do you cope with it? And all of these things. persons need to take into consideration. So today I want to speak about a little bit about some common types of cancers and some rare cancer types. Because many times we hear people die of cancer, and sometimes you have never heard of these type of cancers. And you're wondering, where did they get it from? Now, a typical example is me. I mean, less than a year ago, my sister died with leukemia, and I'm wondering where, how did my sister get such a rare type of cancer? And it's puzzling. It's puzzling. It is, you don't know how to explain it. The doctors do not know how to explain it. Where did she get it from? Just a few months ago, she was healthy. And why is this happening now? So these are the things that we need to be mindful of. Because one moment the person is there with you, the next moment the person is gone. And these rare types of cancers, some of them are so aggressive. And I can tell you, we have to take all of these things into consideration. So, some of the common types of cancer. Of course, you have breast cancer, and these are one of the things we had been advocating persons to come out to do their mammogram. And we have a lot of women diagnosed with breast cancer, and more we're seeing younger women diagnosed with breast cancer. Of course, it mostly affects women, but that doesn't mean men cannot get breast cancer. Though men can develop it too, it often shows as a lump, skin changes, pain, nipple discharge. So you have family history, age, hormonal changes, and alcohol use can increase risk. And let me tell you, a lot of women drink. You know what's a TUSAB? Like the more they drink, the more you're not seeing. They just drink and drink and drink. And they drink a lot of alcohol, and they engage in binge drinking. That means they consume a lot of alcohol for the day, especially on a weekend. And what is most alarming, you see women drinking by a bar every single day. I mean, growing up, I wouldn't see it. I mean, women drink, but you see younger women engaging in alcohol drinking now. And these are the things that increase the risk of breast cancer. Doctors usually detect it through mammograms, scans, biopsies, and treatment may include surgery, radiation, chemotherapy, or target therapy, depending on the stage. So you hear somebody say, I have stage 1 breast cancer, stage 2, stage 3, and it goes on. And there are different types of breast cancer also. So these are the things you have to take into consideration. So 2 is lung cancer. Lung cancer starts in the lungs and is commonly linked to smoking, though non-smokers can also be affected. Persistent coughing, chest pain, breathlessness, and coughing up blood are common warning signs. It is usually found using imaging tests like CT scans, followed by biopsy. Treatment may involve surgery, chemotherapy, radiation, targeted drugs, and immunotherapy. So one of the things it is saying there, sometimes non-smokers can also get lung cancer. It depends on the type of job that you do, what you're exposed to, the different chemicals. Even if you're a non-smoker, but you always sit by smokers, that is a secondhand smoking. All of these have to be taken into consideration. And you hear somebody with lung cancer and the person cannot breathe, it's like a nightmare. So colorectal cancer This cancer affects the colon or rectum and is more common in adults over 45. Changes in bowel habits, blood in stool, abdominal pain, and unexplained weight loss are common symptoms. It is often detected through colonoscopy or stool tests, and the treatment usually includes surgery along with chemotherapy or radiation if needed. A lot of people cannot poop for days. I'm not saying that you can get cancer, but your eating habits, high in fiber, your diet is important. Yeah. And again, the fourth one is prostate cancer. Prostate cancer develops in the prostate gland and it mainly affects older men. Symptoms may include difficulty urinating, weak urine flow, or pelvic discomfort. A PSA blood test and biopsies help detect it early. And that's what they're offering free of charge, a PSA, a blood test to our men. Yeah? Depending on how fast it grows, doctor may recommend monitoring, surgery, radiation, hormone therapy, or chemotherapy. So some of you men need to come out there, especially if you're already hearing about the symptoms and you feel you have one or two, come out and do the PSC. Melanoma, that is skin cancer, begins in pigment-producing skin cells and is linked to sun exposure. A new or changing mole, uneven color, or bleeding spot can be early signs. Dermatological exams and biopsies help confirm skin cancer. Early stage of melanoma is often treated with surgery, while advanced cases may need immunotherapy and targeted treatment. So a lot of people think Black people cannot get skin cancer. Black people do get skin cancer. That is why you need to wear your protective clothing, your hat, your sunscreen, and try as much as possible not to stay exposed to direct sunlight all the time. Yeah. Cervical cancer. Cervical cancer starts in the cervix and is commonly linked to HPV infection. Abnormal vaginal bleeding, discharge, or pelvic pain are common symptoms. Regular pap smear and HPV testing help detect it early. Treatment may involve surgery, radiation, chemotherapy, and immunotherapy. So that is why we have been encouraging the women to come there to do their pap smear free of charge. And we have the new sample collection technique where they test for HPV. Again, we're always asking women to come out and do these things. So the next one we have is pancreatic cancer. Yeah, and I know somebody who died of pancreatic cancer. Pancreatic cancer starts with the pancreas and is often diagnosed late due to the vague symptoms like abdominal pain, jaundice like yellowness of the eye, the skin, weight loss, fatigue. Imaging tests and biopsies are used for diagnosis. Treatment usually includes surgery when possible, along with chemotherapy and radiation. So, 8, we have ovarian cancer. Ovarian cancer can affect women of any age, but is more common after menopause. Symptoms like bloating, pelvic pain, appetite changes are often subtle. Imaging tests such as CT scan, like MRI, PET scan help in determining the staging. Treatment typically includes surgery and chemotherapy. Number 9 is leukemia. Leukemia is a blood cancer that affects the white blood cells and can occur at any age. It often causes fatigue, frequent infections, easy bruising, or bone pain. Blood tests and bone marrow exams confirm the diagnosis. Let me tell you. And that bone marrow test It's nothing easy. It is so painful. Treatment may include chemotherapy, targeted drugs, immunotherapy, and stem cell transplants. Lymphoma. And lymphoma, that's another type of cancer. So I'm on cancer number 10. So all these are various forms of cancers. Lymphoma affects the lymphatic system and can cause swollen lymph nodes, fever, night sweats, and weight loss. It is diagnosed through lymph node biopsy and scans. Treatment options include chemotherapy, radiation, immunotherapy, and sometimes stem cell transplants. So the lymph nodes is what we call the glands in our body. Liver cancer, that's 11. Liver cancer often develops in people with chronic liver disease, hepatitis, or cirrhosis. Symptoms include abdominal pain, jaundice, and swelling. Imaging scans and blood tests help detect it. Treatment options range from surgery to transplant to targeted therapy and chemotherapy. So you can well imagine. 12, kidney cancer. Kidney cancer usually affects older adults and may cause blood in the urine, side pain, or fatigue. Imaging tests like CT scans help identify it. Surgery is the main treatment along with targeted therapy, immunotherapy for advanced cases. Thyroid cancer. Thyroid cancer develops in the thyroid gland and is more common in women. The neck lump or voice changes are common signs. Ultrasound and biopsies help diagnose it. Treatment usually includes surgery and hormone or radioactive iodine therapy. Wow. 14 is bladder cancer. Bladder cancer often causes blood in urine and urinary discomfort. It is more common in smokers and older adults. Wow. That I did not know. It is more common in smokers. Cytoscopy and imaging tests help diagnose it. Treatment may involve surgery, chemotherapy, radiation, and immunotherapy. I didn't know smokers as for bladder infection. Wow. So you have stomach cancer, so gastric cancer, that's number 15. Stomach cancer begins in the stomach lining and can cause indigestion, pain, weight loss, vomiting blood. Endoscopy and biopsy is the key diagnostic test. Treatment includes surgery combined with chemotherapy or radiation. And these are the things, let me tell you, when you go for an endoscopy or colonoscopy, you could well imagine when they have to push something inside to go down or from your anus going up, you could really imagine, the discomfort. Esophageal cancer. This cancer affects the food pipe and often causes difficulty in swallowing and chest discomfort. It is linked to smoking, alcohol use, and acid reflux. Diagnosis often includes endoscopy and imaging, while treatment may include surgery, chemotherapy, and radiation. So a lot of people that drinks and like to vomit, the acid back going up, they can really affect their stomach lining. And that's something people need to take into consideration. The alcohol use and the smoking. So that is three of the cancers they make mention of smoking. So endometrial or uterine cancer. Endometrial cancer affects the uterus lining and is common after menopause. So that's two cancers we've seen that is really common after menopause. Abdominal vaginal bleeding is a key warning sign. Ultrasound and biopsy helps diagnose it. Treatment usually involves surgery with radiation or hormone therapy if needed. The things women have to go through. Yeah? Brain cancer. Brain cancer starts with the brain cells and can cause headaches, seizures, vision issues, personality changes. MRI scans, biopsies are used for diagnosis, treatment, often radiation and chemotherapy. Bone cancer, like osteosarcoma, are often common in children and young adults. Persistent bone pain or swelling is common. Imaging and biopsy confirm diagnosis. Treatment usually includes surgery and chemotherapy. 20, head and neck cancer. Oh, really? These cancers affect the mouth, throat, voice box, and sinuses. Symptoms include sore throat, voice changes, mouth sores. Diagnosis involves exams and biopsies, while treatment may include surgery, radiation, and chemotherapy. Testicular cancer. Yeah, and we do a lot of young men don't do the testicular self-exam, and we have been teaching the young men to do so and to look at the signs, look for the signs. Testicular cancer mainly affects younger men and often presents as painless lump or swelling, and not blue balls like some people think. Ultrasound and blood tests help diagnose it. Treatment highly effective and may include surgery, chemotherapy, and radiation. Soft tissue sarcoma. This rare cancer develops in muscles, fat, and connective tissues, and often appears as a painless lump. Imaging and biopsy confirm the diagnosis. Treatment usually involves surgery with radiation and chemotherapy. So you're on 22. And at 23, bile duct cancer. So I cannot even pronounce how you call bile duct cancer. The bile is what you call the little thing when you kill the animal and they say it's bitter. That's what you call the bile. I forget the Creole name. I've just forgot the Creole name. What they call the bile. It's when you slaughter the animal, they don't allow it to burst on the meat because they say it makes the meat very, very bitter. So the bile duct cancer. Bile duct cancer is rare and affects the ducts that carry bile from the liver. Symptoms include jaundice, itching, and abdominal pain. Imaging biopsy help detect it, and treatment may include surgery, chemotherapy, and targeted therapy. So in all, I've listed at least 23 types of cancers for you. 23. Just to give you a synopsis of some of the common types of cancers, as well as some of the rare types of cancers. So you could well imagine some pertain to women, some for both men and women, some for men. So, I mean, nobody is immune, no matter what age group when it comes to cancer, economic status, occupation. It does not discriminate against any of these things. So you have to take all of that into consideration as it relates to your lifestyle changes, your diet changes. I mean, knowing the risk factors and knowing your family history and take it from there and doing the relevant tests to detect it early. So having said that, I feel that I have said quite a bit about cancers, the types of cancers, what you should look for, and so on, the abnormal changes in the body. And people need to know their body. And I keep on telling young people that you need to observe the changes in your body, on your body. You need to look at yourself in the mirror and observe the changes. Women, most times your partners are the ones to see the changes. You need to observe, do your self-examination, your self-breast examination. You have to feel your body. You have to look at your body. You have to turn, look at yourself in the mirror. Look at yourself naked. Look front, look back, look sideways. Know your body. See what is happening. What was there? What has disappeared? What just developed? You need to do these things. Women are afraid to look at themselves naked in the mirror, as well as men. Observe the changes in your body. Look at things. Observe what is happening. Yeah. So having said that, I want to wish everybody a wonderful day, as well as a good week. I'm hoping that persons will take all of this into consideration, especially our men. We're inviting you to come to our men's health clinic, Soufriere Hospital, first and third Wednesday of every month, and our Lafag Wellness Center every second Saturday of every month. For our wellness center, you can speak to your nurse or the CHA. They will guide you when the nurses are available to do the pap smear and the breast examination, and also for those persons that are eligible for the free mammogram. So I'm always repeating these things because these things are 3 services that are available. These are early detection tools for breast cancer as well as prostate cancer. And also the pap smear that is available free of charge, early detection tool for cervical cancer. Yeah, so these are the testing and everything else that are available for you, the public, free of charge. You just need to make time. So come in and inquire. Having said that, let me say thank you so very much to Soufriere FM and all staff members for providing service today. Ulan, you are surely missed. Rome and Jen for assisting me, and Cabrina, I have not seen you for a while, but hello. See you next in the weeks to come. And I would like to say to all our community members, don't be afraid to come to our wellness centers. If you're not comfortable at one wellness center, feel free to come to our various wellness centers. We have wellness centers in every constituency or many communities within the constituency. Make some time, take some time out to visit the wellness centers. And when you do, there are different clinics ongoing. Bear some patience. One of the reasons is because persons always feel as soon as they arrive, they need to get the service. No, it does not work like that. There are other persons before you that needs the attention. And I would like persons to get away from that mindset. How would you like if you go to the doctor and the doctor say, what's wrong? And just write a prescription. And don't probe to find out if anything else is happening to your body. So you need to give people time with the doctor. Even if you heard a person laugh inside of there, maybe that's the remedy the person needed. So you need to have a level of patience when visiting the doctor. Also, for persons coming for medication, please bear patience. Okay? Some of you coming free for prescriptions, and yet still you expect, in a matter of seconds to get, no, it does not work like that. Bear patience, take your time. You know you coming to see doctor. You do not know how many people that will be before you. Carry your water or carry your bite to eat. Yeah? So I'm encouraging the general public to do just that. For persons who are bringing elderly people to to seek medical attention, bear patience with them, or persons who have older persons at home that needs to seek medical attention. One of the things we're encouraging you to do is to accompany these people. And some of them do not have a phone. Some of them, by the time they have to wait to see the doctor, then they have to go and get the medication, and it all depends on the condition. So some of them are having to go back home, and they do not have time to get the medication. Especially if one pharmacy doesn't have it and they have to go to another pharmacy. For those loved ones or children that has vehicles, and if your parents or one of your loved ones is seeking medical attention and the mobility is difficult, try as much as possible to help out. Because we know in our communities, the transport system can be a little bit difficult. Provide that level of support to your loved ones. And these are the things that we've been seeing and we've been observing. It could be your mother, your father, your aunt. Provide that level of support to them. Okay? As long as you have the time, go ahead and perform that good deed. It goes a long way, trust me. So having said that, let me say goodbye to all our listeners, and hopefully next week, my colleague Fawn Minville will be there, and she will be providing you with some information as it relates to surveillance, and she will be having a guest with her. So I'm hoping that you can tune in and listen on to that program. So again, have a wonderful day, everybody, and do take care.
Be against a ball, but me nah hush none. If a bad mind alone, me dead, me done that. If a them alone, me dead.